name's Chelsea, and today we're going to be talking about periodontal disease. So, periodontal disease is important to me because I have two very close people in my life who are affected by it. My dad ended up being diagnosed with periodontal disease when he was diagnosed with it earlier this year and ended up going through a very painful procedure where she lost most of her teeth. She now has a set of dentures. And I just couldn't figure out how somebody who ritually brushed their teeth after every meal could possibly end up going through this. But the answer was simple. She never flossed. So you'll learn why it's so important to floss in order to prevent periodontal disease later on. So after watching my mom go through this, it just made me more aware that I'm genetically inclined to develop this disease myself and also my children. So, I have an 8-year-old and a 2-year-old. My 8-year-old, I constantly have to remind her to brush her teeth. And my son is just now learning to brush his. And, I want to show them through my good habits how to properly take care of their teeth. And hopefully they'll carry these habits on into adulthood. So I can spare them what I saw my parents go through, which was social embarrassment, low self-esteem, financial burden, pain, and other complications. So what is periodontal disease? Periodontal disease is when bacteria gets trapped under the gum line, and when it's left there for anywhere from 2 to 3 days, it hardens into plaque. And plaque is basically a reservoir for bacteria, which leads to infection, and that can lead to the tooth separating from the gum line. So in order for you to better understand exactly what I'm talking about, I want to share with you the major risk factors, what the complications are, and ways in which you can prevent yourself from this happening to you. So, according to the American Dental Association, you may be at risk for developing periodontal disease if you have poor oral hygiene, if you are a smoker or you chew tobacco, if you have a genetic predisposition, or if you maybe have crooked teeth that are hard to clean. If left untreated, some complications that may arise, surprisingly, are stroke, heart disease, respiratory problems, and of course tooth loss. However, the good news is periodontal disease can be easily prevented by simply brushing twice a day, flossing once a day, and visiting your dentist every 6 months. So, in conclusion, periodontal disease is it's just horrible for anybody to go through. It can cause you to have social embarrassment, low self-esteem, great financial burden, pain, and besides the obvious tooth loss, you can also suffer other hazardous health concerns such as stroke, heart disease, or respiratory problems. So all of this can just be prevented by doing what the dentist tells you to do. Just brushing your teeth and flossing all that bacteria out from underneath your gum line every day, and making sure you visit your dentist every 6 months in order to remove any plaque that may have formed. So I hope these tips can help you in order to live a healthier life. Thank you.